The threats and challenges of biofilms. Understanding the structure and function of biofilms helps us navigate their threats and challenges. A biofilm is made up of microbial columns interspersed with voids and channels. Like a bacterial house, biofilms protect bacterial residents from threats like desiccation or drying out, biocides and antibiotics, metal cations, ultraviolet radiation, protozoan grazers in marine environments, and host immune defenses. The epifluorescence microscopy image at the right is a stained biofilm grown on stainless steel. The blue region holds the majority of the bacteria in a protective slime, while the darker regions, the voids and channels, allow for nutrient transport within the film. While biofilms protect bacteria, they make it difficult for humans to get rid of infectious bacteria. Biofilms are responsible for persistent or recurrent bacterial infections. After sticking to a surface, like a tooth or medical device, a mass of slime encases the bacteria. The biofilm then grows and, reaching maturity, releases independent bacteria from the film, ready to colonize other surfaces. Human defenses against bacteria often fail when the bacteria are allowed to form a biofilm. In healthcare settings, medical devices such as catheters block the body's natural barriers and act as a ready surface for bacterial adhesion and biofilm growth. Another defense often used by humans, antibiotic treatment, has little success in eliminating biofilm bacteria and can even lead to increased antibiotic resistance. Antibiotics may not work when confronting biofilms due to incomplete penetration of the antibiotic. The spore-like or dormant state adopted by some bacteria in the film may be another reason antibiotics fail. Another possibility is that the biofilm environment, such as varying pH and oxygen levels, alters the chemistry of the antibiotics. It is a major concern that antibiotics cannot help the prevention or mitigation of infection. The National Institutes of Health state that 65% of microbial and 80% of chronic infections are associated with biofilm formation. Biofilm formation is dangerous in a healthcare setting. Hospital-acquired infections, which affect 1.7 million patients in the United States each year and lead to the death of 98,000, are acquired while the patient receives treatment for a different ailment. These infections arise in the hospital, increasing length of stay and risk of death. For example, a patient might arrive in the hospital, use a catheter in a lengthy pelvic surgery, and acquire a urinary tract infection. A urinary tract infection is an example of a hospital-acquired infection common in hospitals. In fact, urinary tract infections are the most frequent hospital-acquired infection in high-income countries. Of all hospital-acquired urinary tract infections, 75% are reported to be catheter-associated UTIs in the United States. Nickel and Costerton report that biofilms are responsible for all catheter-associated UTIs.